Jacqui Felgate, and a very warm welcome to Luke Darcy, Joe Stanley and Dr. Nick Carr.
Good to see you, Joe.
How lucky are we today to be amongst this beautiful green foliage and all the flowers? Spring has sprung.
And for me, spring is definitely the season for love. And I know that we all know the 5 love languages. You've got acts of service, words of affirmation, physical touch, quality time, and receiving gifts. And for me, I'm very much an acts of service kind of girl.
To be honest, I'll take them all because love really makes the world go round, as we know, and money, of course. But today we are talking about love in all of its forms.
Beginning with a family connected by their differences.
Heinze scales new heights and falls in love with the indoor sport of bouldering.
And Joe, I'm all about loving yourself and your body with all its nuances, including what's sloshing around inside your mouth. Yes, I will be talking about saliva.
Oh, well, yeah, OK, we're all really looking forward to that, Dr. Nick. But let's go back to the pandemic a little bit. We're always wearing masks, no saliva there. But a lot of people actually did connect over that time.
And one such couple whose love blossomed during lockdown is Dave and Lana Serpel. They met on a very unique online support group. And as they say in the classics, the rest is history.
I was born with a rare genetic condition called ectrodactyly ectodermal dysplasia cleft syndrome, so in short, EEC syndrome, and it presents very differently in each individual. So I was born with missing fingers, so 7 fingers to be exact. I grew up in a very small town, so I was known as Alana with the hand difference or the girl with the hand difference. And I remember vividly at high school we had cardigans and I used to hide my hands under the cardigans, and my acceptance of my hand difference was absolutely not there.
When Lana signed up as a board member for support group the Aussie Hands Foundation, she was keen to connect with others who shared her life experiences. But as she signed into her first online meeting, she had no idea just how deep one of those connections would be.
I joined the meeting and already it was this huge sense of belonging. Dave then popped up on the screen. I recall he was actually slightly late to the meeting and he introduced himself, and straight away I just felt this connection with him as a person, and he was just very light and bright and charming.
My name's Dave Serpel. I'm 25 years old. I was born in 1999 with a condition called symbrachydactyly. Basically, one of my hands has 3 missing fingers. I was on this Zoom meeting for Aussie Hands one night. We were having a board meeting and I laid my eyes on this beautiful woman that I'd never seen before. She came on the screen and I was a little bit sneaky actually. During the meeting, I had my phone there and I was kind of looking her up on Facebook because it said her name down there. So I was giving her a cheeky little stalk and I had no idea that she was thinking the same thing.
With Lana living in Perth and Dave in Darwin, the only way to get to know each other was online.
Dave and I spoke every day via phone or FaceTime, and we kind of took each other on a journey of each other's lives.
Hi, honey. I wish you were here. So beautiful.
We were both born with 7 fingers. So we initially knew that was something we had in common, which is really something that nobody has in common with each other. So that's pretty incredible. However, we very quickly learnt that our connection and the things that we had in common stretched very far deeper than that.
After 3 whirlwind months of texts, calls and FaceTimes, these long-distance lovebirds couldn't stand to be apart a moment longer.
It was such a surreal feeling because I felt like I genuinely knew him so well, but then the physical touch, when we hugged was so new. It's like you were on this tiny screen for 3 months and you're real. I remember we were just driving home, holding hands going, oh, it's you. It was really surreal feeling.
I had driven with, her on FaceTime with the phone in the cup holder and she'd been there, looking up at me. And so actually having her physically there was beautiful. And it did take a little bit of getting used to in the first few days, just having each other there. But again, it felt like it had been such a long time coming.
Are you lost in the moment? Come early 2023, they were engaged with a baby boy on the way. But as Mr. and Mrs. Serpell looked forward to this exciting new chapter in their love story, one big question remained.
Given that I've had individual genetic testing and my parents have also been in touch with a geneticist, I have known for a long time that I would have 50% chance of passing on EEC syndrome to my child. But I think in our love and in our relationship and in the people that we are, we just felt really confident that as parents we could support him either way. It was really beautiful how we found out. We were in the scan and he put his arm up and waved, and we could see what we thought was 4 fingers, and straight away we said, oh, he's only got 4 fingers, and the sonographer said he's actually got 5, but 2 of them are fused.
Lana and Dave's son has inherited his mum's condition, but for him it presents very differently. In addition to some webbing joining his fingers and some foot differences, Jeremiah was born with a cleft lip and palate, requiring several intensive surgeries over his first year of life.
The experience over the last year with Jeremiah has been incredible, but the hardest year of our lives. He's an extremely resilient child and amazes us every day, but the intervention that he's had is huge. I think we're just grateful that he won't remember a lot of it.
We will, as parents, take every step to make sure that he's around the most supportive community of people. We're going to come out the other side in the end, and, everything's going to be okay. Oh, wow.
Last year, the Serpells relocated to Melbourne, allowing them easy access to top paediatric experts like plastic surgeon Professor Christopher Coombs.
I first met Dave 25 years ago when his mum brought him along with his hand difference. Treating young children is always a privilege. And as you get older, you then start treating the children of the children you've already treated. I find that one of the most satisfying things in my career.
You gonna go on the swing?
Oh, yeah.
You gonna go high?
Because both David and Lana have hand differences, they've got lived experience. And so there's no question that Jeremiah's future is golden. He is a smart little boy who's going to grow into a wonderful human being.
Oh, good boy.
Jeremiah and I recently sat in a room there was 5 of us, including Jeremiah and I, with people with EEC syndrome. Yeah. No words. To have that opportunity to sit in that room with other people and other children and parents with the same condition was like a dream come true. Yeah.
Ooh.
We love Darcy.
We do,
Don't
Joe.
we?
I think so.
Of course we do. But one thing we do not love is the rise of vaping, especially in kids and teenagers. And I've read that kids as young as 6 are being caught vaping at school.
Joe, some new laws coming through on the 1st of July aimed at cracking down on colourful packaging and flavoured vapes, which, let's be honest, are directly aimed at kids. There's also therapeutic vapes that are going to be available with a doctor's prescription, but the laws are changing so often, it's fairly confusing and hard to keep up with.
It is confusing, Darcy. I mean, vape shops are popping up everywhere, and even the proposed laws are being relaxed. As of October, it's only people under 18 who will need a prescription from their GP to get vapes. And if you're an adult, you can get a vape just by having a chat with your pharmacist.
Yeah, it might be, Joe, a bit like smoking and underage drinking, where the laws really are there, but they're probably not going to be enough to protect kids 100% into the future.
Well, the evidence is overwhelming. Vapes should be avoided. And yes, for your overall health, but also if you are trying for a family.
So this is where we freeze the eggs and sperm and embryos. So we freeze them, we plummet them to minus 195 degrees, and they're snap frozen in time, and they're snap frozen in the liquid nitrogen.
Amazing.
Dr. Lynn Burmeister's work in IVF has helped bring more than 10,000 babies into the world, and she wants that number to increase. But vaping is leaving its mark.
So, Dr. Lynn, do you think a lot of people would be surprised to hear about the link between IVF and vaping?
Yes, so it's not really well researched at the moment, but we know vaping is very bad for our lungs, bad for our kidneys, bad for our reproductive system as well. We know that vaping contains chemicals that you don't see on the packet. So, for instance, vaping contains formaldehyde, chlorine, weed poisoning substances. So it's filled with a lot of chemicals that can be hormone disruptors. And those hormone disruptors can affect our egg quality and our sperm quality, and also affect our future reproduction.
What about sperm production?
So we know that it probably won't affect the number of sperm, but it will affect the quality of the sperm that's coming out. So it will affect the morphology, which is the shape of the sperm. It will also probably affect the motility of the sperm, so how fast the sperm is swimming, because of these substances in the vaping products. So we know that these substances are going to definitely play a role in infertility in the future.
Are you surprised of the number of women that are coming into your clinic and they're vaping?
Yeah, so I always ask, do you smoke or vape? And they're not smoking anymore, they're vaping instead, because they think vaping like, I'm just having a strawberry vape, that should be fine. It's actually not fine, and I told them what's in the vapes, and they're quite horrified to know that they've been vaping in chlorine or even formaldehyde, and also some of them even contain arsenic as well.
So we can see here, this is a good quality embryo, but if a person was a vapor, what would you be able to see on the screen?
Well, we may see the embryo slower than normal, and it may not hatch out of its shell when we expect it to hatch out. We also might see a lot of fragments in the embryo and a lot of abnormal black spots throughout the embryo.
And is partly that because of the chemicals that are in vaping?
Yeah, so the chemicals in vaping and also smoking affects the ultimate outcome of that embryo, and also can affect the baby later on in life.
What's your message to women who are trying to get pregnant that are still vaping?
So if you're trying to get pregnant, we really need you to stop vaping. It's going to have harmful effects on your eggs, and we know that poor egg will create a poor embryo quality and will reduce your fertility chances. And we even see with IVF, if someone is smoking or vaping, the embryo quality is usually of poor grading.
And my particular interest in men with sexual dysfunction, there's increasing evidence that it's leading to the development of erectile dysfunction, that is the inability to get a good erection or keep a good erection.
Dr. Christopher Love has made a significant difference to the quality of life for thousands of men with sexual health and fertility problems. But more recently, he's seeing the fallout from vaping and male infertility.
There's all these chemicals that are poorly understood. I mean, vapes have got industrial solvents in them. They've got chemicals that are in pesticides, chemicals that are in drain cleaners. You know, they're actually in the vape smoke, let alone nicotine. So even a single cigarette, a single vape will have an immediate effect on blood flow to the penis. You get a production of adrenaline in the body, and adrenaline causes small blood vessels to close down. And that's exactly the opposite of what you want if you want a good erection, because erections are about blood vessels in the penis opening up. So there's the immediate effect of what nicotine does and the long-term effect. You're actually getting more nicotine in a vape than in a cigarette, so the effect will be magnified. And then you're having young people, you know, mid-teens, if not young teens, taking it up. But increasingly, both myself and other urologists in this area are seeing younger men with erection problems. And whilst you can't blame it all on vaping, it is definitely a factor. And it needs to be made public, because I don't think people realise.
Well, Jack, anyone who lives in a major city like we do will be very aware of electronic scooters or e-scooters whizzing down the path and having a bit of fun. Are you a fan?
I like them. I've used them overseas. They're a great way to get around if you follow the rules. But cities like Paris and Rome and Montreal have either banned them or restricted their use. And it looks like Melbourne is going the same way.
Yeah, City of Melbourne have had a 2-year trial for e-scooters, and they're going to break their contract 6 months earlier, it looks like, because of safety concerns, as you discussed, people not using them properly.
So they polled residents and traders, but in particular emergency departments. And basically they saw the spike in injuries.
As you said, if you wear a helmet, you use them properly, they're great fun. They're a great addition to the city. Unfortunately, people just don't seem to be able to get that right.
Just do the right thing. It's very simple. Well, from a mode of transport to 2 wheels to muscle power alone. Did you watch bouldering at the Olympics up the rock wall in 4 seconds?
I loved it, Jack. The Indonesian gold medal winner was a superstar. I love all the new sports. And they made it look pretty easy at the Olympics, but we sent Luke Hines along to check it out and gave you a little indication it's not as easy as it looks. Check it out.
All right, so we're going to climb the demo climb here. We're going to go through how to fall safely. Okay, so bouldering is climbing really short walls, but the movement is going to be quite wacky and weird. So it's not about going up a staircase. It's kind of like you're dancing up a 4-metre wall. We're going to put 2 hands on this hold, okay? Bring our hands down, 1, jump down, roll onto our back, hands across our chest. So that with bouldering, you won't have a harness. You'll have crash mats underneath you. So you're climbing up for about 4 metres and you can down climb, or if you fall, you're going to roll onto the mats. Okay, so when we're climbing, I really want you to focus on driving through your legs. If we jump on the wall and just do a really good pull-up on every single move, we're going to get really tired, okay? So you're going to drive through your legs. So my left foot. The common misconception with bouldering is that it's just upper body, that you just need to have really strong arms. The idea is that you're using your whole body, you're using your legs to drive, and then your point of contact is your hands. Push through your legs.
Yep.
Good, nice long arms, you got it.
First hand up there.
Awesome, up to the next hold. Good, you got it.
Being that my point of contact is my hands, how important is grip strength?
It will be important, but not necessarily when you're learning. When you're learning, you're not getting on holds that are so small that you're reliant purely on your grip strength. As you climb more, you will build that grip strength and you'll be able to try harder climbs. Good, and then we're gonna drop your feet and we're gonna roll onto your back. Nice one.
Okay, cool.
Really good, nice.
Yeah, that's great.
Beautiful.
I love it. Tell me about the grading system and the correlating colours.
So different gyms use different systems. At Urban Climb, we use a colour, tells you the level of difficulty of the climb. So a yellow is our easiest colour and white is our hardest colour.
Will I be on white today?
I would be an amazing coach if you're on white today. I would be fantastic. So 2 hands on the start tag, right foot up, we're going to tuck in and jump. And then we've got our holds up ahead to finish off.
Hang on. What's your experience with how people are feeling and acting during a session?
I think people are really excited by climbing because it's so fun. The movement-based activity that it is just means that you do things on a vertical surface that you wouldn't do on flat ground. Particularly a good example is a dyno. In climbing, you can do a move called a dyno where you jump on the wall, and it's pretty awesome.
Ooh, okay.
Oh, you got it.
So close. I didn't commit.
Yeah, you let go too early.
I did.
Sink low.
Sink low.
Launch your hips forward, pull in at the end. Stand all the way up. Come on, Luke. Yay!
Okay.
Is bouldering about the body or the mind?
Bouldering is about both. People will talk about climbing being extremely mental. When you're problem solving your way through the climbs, it's really clearing for your mind. But also for most people, they just describe that it doesn't feel like they have to force themselves to come and exercise because it's so fun. Climbing is inherently so natural for humans and super fun to do.
It's tough.
Don't pull with your arms. Drive through your left leg. Good.
Oh, it's tougher than I thought.
Has anyone ever gone up to that 4-metre mark and then looked down and realised, I'm panicking?
Literally every day. Being scared of falling is one of the most innate fears we have as humans. But we do also get a lot of people coming to climb that are scared of heights and they use climbing to work through that fear. Left hand up, good. Drive through that left foot. Come on, you can do it. Yeah, nice. Both hands.
There are a lot of climbing couples. Like, do people meet their future? Oh, you're smiling.
I'm laughing because my husband and I met climbing 11 years ago.
I love that story.
Yeah.
Love bloomed between you guys.
Yes.
Do you often see a little bit of a spark on the wall?
Yeah, it's pretty common that people meet climbing. Climbing is a very all-consuming activity. We talk about it being not just a hobby, but a lifestyle. So it's kind of hard to climb and date someone who doesn't climb if you're that committed to it. That was awesome.
That's fun. It's tough.
nothing beats the challenge of climbing this bouldering wall because it tests you both physically, mentally, and emotionally. Because that moment at the top, when you're not sure if you're going to be able to grab that next handhold, is exhilarating. But then you land back down on solid earth and you are so incredibly proud of yourself. If you're looking to challenge how you move, how you feel, but most of all, how you think, bouldering may just be the next thing that you need to try.
Now, Joe, I've always felt the world was perfectly decamped into two very special camps, and that's either a dog lover or a cat lover, but you're one of the rare breed that's got a foot in both sides.
It's very possible to equally love dogs and cats, and I do. I love my dog, love cats though. But the generally held theory is that dog people are outgoing and adventurous. Would you say that rings true for you?
Rings true, yeah.
Yes. And cat people are more introverted and sensitive. And I have to say, as a cat lover and a dog lover, it makes sense that I am known as an extroverted introvert.
Well, there you go. You are that special type of breed. Even the most ardent cat lover gets frustrated with a cat that's destroying the furniture, and turns out that's a stress response. And do you know what stresses cats out the most, more than anything else?
Well, the number one trigger for cats feeling stressed is being threatened or insecure around young kids in the home.
Yeah, and kids, when you think about it, they're unpredictable. They jump around. They make cats, all the things that cats don't like. That's what young kids bring. And so if you've got a cat that's stressed out, the experts will tell you, like any pet, needs more attention, more love and a bit of care. Or, Joe, just simply get a dog.
Are you telling me dogs don't destroy a home as much as cats? They're very destructive. And what about the drool? I mean, you know, the constant licking in the drool, that's
Fair
what
point.
we get from our Labrador all the time. Speaking of which, here's Dr. Nick with some fun facts about saliva.
When I was a kid, I had a beautiful pooch, Pancho. He was a boxer dog, big, devoted, dumb, and always drooly. So much so that when he shook his head, slobber would fly everywhere. Beautiful. But if you think Pancho drooled a lot, what about us humans? Well, on average, we produce a whopping 1 litre of saliva every day. And we do this because it has a stack of jobs to do. First of all, it provides a protective layer for our teeth and gums. It has antimicrobials that reduce the risk of infection, and it brings minerals that help keep our smile all sparkly and bright. Dogs, cats, and most mammals lick their open wounds. In fact, we humans often do it too. It's evolutionarily programmed into us because licking helps clean the wound, and all those antibacterials reduce the risk of infection. And even though saliva is 99% water, that other 1% also contains enzymes that get to work on our food so that digestion has begun even before the steak hits the stomach. Now, dry mouth is so common that we medicos have a name for it, xerostomia, from the Greek xeros, meaning dry, and stoma, mouth. The commonest cause is medications which slow down salivary gland function. And here's an important tip if you do suffer from dry mouth. Try to drink larger quantities less often, because it's been shown that frequently sipping on water washes away the protective saliva and leads to tooth and gum disease. Hypersalivation or excess saliva can also be caused by medications. And of course, it's common in babies who haven't yet developed the muscle coordination to adequately swallow their spit. Add in a bit of teething and your baby's starting to look like my old dog, Pancho. Talking of Pancho, why did he drool so much when my current dogs, Sam and Rosie, don't? Well, they're border collies with longer snouts. Breeds like boxers, bulldogs, St. Bernards and so on tend to trap their saliva in their heavy jowls and loose facial skin, leading to all that horrible slobber. But we love them anyway.
Jack, we're both big fans of the latest skincare tips and hacks online, and I think you'd agree there's some good and bad and downright bizarre out there.
I absolutely agree with that. And people are investing more and more when it comes to their skincare. But you know what? It is a multi-billion-dollar industry, but it is a real minefield when it comes to knowing exactly what's best for our own skin.
Well, the great news is that the latest trend for 2024 is skin minimalism. It's awesome when you find out what you've already been doing is the latest trend, because essentially it means simplifying your daily routine using fewer products that have benefits, multiple benefits in the product.
Well, that's good advice. I think keeping it simple is always best, because I never know, is it the toner, the serum, the moisturiser, or the serum after the moisturiser? It's also confusing.
I really don't know. The one thing that I never, ever leave the house without these days is sunscreen, and I wasn't really that obsessive about it before, but now I wear it every day, even when it's overcast.
Well, we know better now, don't we? And speaking of mixing it up, it's just like your gym workout, isn't it, where you isolate different muscles at different times? Well, variety is also the spice of life when it comes to skincare.
As sporty as it sounds, skin cycling is pretty simple and doesn't involve an exercise bike. It really involves using one or two products that you use at various times of either the week, the month, or the year. It might look something like using a vitamin A at night one week and using an alpha hydroxy acid or beta hydroxy acid the next week. These products often work in harmony, helping cellular turnover, lightening and brightening the skin, unblocking pores and reducing oil gland size, but when used together, might actually over-irritate the skin. I think skin cycling has become really popular because we now have access to a whole range of skincare actives. It can be quite overwhelming and confusing, and we often have FOMOS, which is fear of missing out on skincare. By using them or cycling through them one by one, we get a feel of them, we understand how skin reacts to them, and get the most out of the products for our skin. While skin cycling sounds like it needs a lot of planning and forethought, it doesn't have to. You can simply listen to your skin in terms of any symptoms that you might be developing of dry skin, irritation, itchiness, or even inflammation, and respond by either incorporating or removing skincare actives that will help your skin state. If you are thinking about trying skin cycling, are you travelling? Are there any hormonal changes affecting your body at that time? What's your budget? And what's the environment around you? These simple factors will help you understand and decide which skin products that you will cycle through over the course of a month or over several months.
Routine, that is the absolute best advice that I can give. Taking the medication at the same time each day and making sure that it's in sight. So what I mean by that is it could be on your bedside table, it could be in the bathroom, in an area that you know that you're going to be around. If you're not good at remembering to take your medications, setting that alarm is going to just be that extra reminder. I often get asked, what am I going to do if I think I've taken my medication and I'm not sure if I've taken it? What I would recommend is a dose administration aid, something like a pill box, and then you can visibly see if you've taken your medication that day. It's really unlikely to develop an allergy to a medication. So a mild allergy could be symptoms like a rash, nausea, diarrhea, and upset stomach. If you do experience a severe allergy, symptoms such as swelling of the face, lips, or tongue, or shortness of breath, stop the medication immediately. If it's an intolerance that's feeling that it's making you feel unwell, see how you feel. If you're finding that the side effect continues, that's a referral point to have a chat to your local GP to see if it's the medication and if it's manageable. But it is really rare to experience a severe allergy. It is really common for patients to keep medications at home, saving them for a rainy day if they've got the same symptoms. For example, if you've got a sore throat and think that you have an infection and you've got some leftover antibiotics, for example, it might be a different bug that's causing that sore throat, in which case a different antibiotic needs to be prescribed.
Well, Jack, it's Asthma Awareness Week, a condition that 1 in 9 Australians has to deal with.
And that is a lot of people dealing with the extra pollen in the air now that we're hitting spring.
It's actually one of the most prevalent chronic diseases in Australia. It can range from mildly annoying for some people to literally life-threatening.
And Ambulance Victoria is urging everyone to update their asthma action plan so you can best manage the condition.
And that can literally go from helping people to saving lives and also relieve the burden on our paramedics and ambulances. Staggeringly, Jack, 56,000 ER visits are asthma-related incidents.
Well, speaking of our overworked paramedics, Ryan De Cruz gives us a lot of skincare tips on this program. So who better to get a bit of pampering than one of our paramedics themselves? Here's Jacqui to do just that.
Michael, you're a qualified paramedic, one of our most trusted emergency services. What inspired you to go down that career path?
My father was ill 25, 30 years ago, and he needed an ambulance. Paramedics arrived at the scene. Amazingly impressed with how they made us feel safe. They had a plan. They looked after my father. And then from that moment on, I sort of thought that was probably something that I'd like to do. And I was kind of hooked from there on in.
You have experiences that would be incredibly confronting for the average person. How do you leave work at work?
I think there's a number of things that I've learned to do over the years. I'm probably at a point where it's the small things.
Yeah.
So as soon as I get home, I take my uniform off and actually put that away. Having a wide variety of interests outside of work also helps. I exercise 7 days a week. Turning the laptop off, turning the phone off, and really making sure that there's time to spend with kids, family.
I think all of us could learn from that. Right now, we're in asthma season. What's your advice to asthmatics about having an action plan?
So there's a couple of steps. First of all, know your signs and symptoms. Make sure that you've got a current plan. So visit your GP, review the plan. If you feel those symptoms are coming on, you might want to go back to your GP or call 000 and engage the use of the emergency services.
More than ever, paramedics are in high demand. What is something that we can do to really relieve that pressure?
There's a couple of options. So first and foremost, you've always got your GP that's available, and you've also got pharmacies that are nationwide. In Victoria, there's two main initiatives that we've started, which is the primary patient care centres and also the Victorian Virtual Emergency Department, which is a 24-hour service, and that's free for all Victorians.
Wow, I didn't even know that actually existed.
Fantastic service. It's a game changer.
Coming to life outside of work, I heard that your amazing teenage daughter, Maisie, actually introduced you to the world of beauty. Tell me more about this.
So it started when she was a young girl during the summer months that my daughter would want my fingernails and my toenails painted. Then she'd want facials and whatnot done. So we'd go overseas and she'd want a wingman, someone to go with her to get her face and have mani-pedis done. And I was that guy.
Oh.
And then here we are today.
So before your daughter introduced you to these amazing beauty treatments, were you a guy that took your skincare quite serious? Did you have a regime at all?
Not really a regime. I had a daily facial scrub, but my daughter's extended that to moisturisers, sun protection, and having a better awareness of what else is out there that I could or should be using.
Michael, I know you use a scrub. However, what other skin steps do you have or do you use?
I use a facial oil and also use a sun protectant.
Amazing. We'll keep that up. And one other step I'd love to introduce to you is a face mask. Have you ever used a face mask before?
First time, Jay.
Oh, yay. Well, I'm really excited because what this does is it locks in your hydration, especially if you're tired, you're working long hours. I find this mask works really well. So as you can tell, you just have to undo it all and it will feel nice and cold. And just place it around the nose and lips. And then we're going to leave that for around 15 minutes and your skin will feel really calm and hydrated. So now it's time to take the mask off and you've got a lot of serum in here and simply press into the skin. So we're going to lock in that moisturiser with using the La Roche-Posay Toleraine Sensitive Cream. And it's really important to massage when we apply moisturiser. Michael, how is your skin feeling after that?
It feels really clean and fresh.
Amazing. So you're confident in giving this a go?
I think so, yeah.
Well, thank you so much for today. It's been a privilege. And all that you and all the other paramedics do for our country, we are honestly so thankful. And I can't think of anyone else more deserving of a little self-care.
Thanks, Jade. Much appreciated.
In the hustle and bustle of daily life, getting adequate sleep can feel like a luxury we can't afford, but desperately want to support both our physical and mental selves. And while counting sheep may work for some, for those 1 in 3 Australian adults who have trouble falling asleep, there's another option available. Nature's Own Complete Sleep Plus Magnesium is a valerian-free formula that uses naturally derived ingredients including ziziphus, traditionally used in Chinese medicine to reduce the time to fall asleep, plus lactium derived from cow's milk that assists in relieving symptoms of stress, a common cause of sleeping difficulty. This is combined with the added benefit of the nutrient magnesium, helping to soothe muscles and relieve muscle cramps when dietary intake is inadequate. Adding support to your sleep is as simple as taking 2 tablets 30 minutes before bedtime. While there are some factors inevitably affecting our sleep quality, there are tools we can put into place to help prepare for rest. Wind down with a book, keep screens out of the bedroom, ignore any screaming or crying children, that last one's a joke, and impossible.
I'm very much embracing spring and happy to say goodbye to those freezing early mornings. I love the colour and the flowers that come with spring, of course the pollen that comes with it, and come to think of it, ants as well. I've had so many ants in my pantry.
Well, the conservative estimates are that there are 20 quadrillion ants on this planet. That's 20,000 million. So maybe not a surprise that a few of them have found their way into your pantry, Jo. Yes. but numbers aren't the only awe-inspiring thing about this creature, because this tiny yet fantastic insect is also famous for looking after its own community.
Yeah, is it true that ants can perform antibiotic-like treatments on each other to ward off infections?
Yeah, not only that, but they've been shown to be able to diagnose and treat injuries. So ants have been observed licking the wounds on the lower legs of their buddies, and higher up on the femur, the upper leg, they've actually been known to perform amputation to stop infection, which makes the ant the only creature on the planet other than us humans to perform purposeful amputation. Amazing.
Absolutely amazing. I will do my best not to step on ants from here on in.
That might be in the middle of a surgery.
It might be. Well, from awe-inspiring insects to the wonder of plants, here's Zoe with a soup sourced straight from the garden.
If you're searching for an ingredient that holds its own in any dish, look no further than avocado. I put it in and on everything, and I'll prove it in our dish today, my spicy avocado soup, pistachio salsa verde, served cold. It's as simple as popping everything into a food processor. Coriander and cumin deliver earthy flavours. Taken up a notch by the heat from the fresh chilli, but balanced by the sweetness of honey. Miso paste adds saltiness and body, but less equals more. This is one intense mix, but the nuttiness of avocado cools down the strong spices. Plus, its buttery texture is perfect for creating creamy soups. And how about that colour? Avocado's benefits go beyond just cooking. In the health space, it's a rich source of magnesium. Now for the salsa verde. Pepitas and pistachios form the nutty base. Adding an extra texture, crunch. I'm keeping the seasonings minimal so there's no clashing with the punchy soup. But lemon zest, garlic, sea salt and pepper complement everything. Serve in a small bowl, a cup, or even a shot glass for funkier presentation.
Dancing on the ceiling, I can't stop this feeling.
This is one of those dishes that can be used to one-up your dinner party game. It's a light, fresh, entree style that will leave them wanting more. Get Nourished is brought to you by Go Healthy. Support nervous system health and muscle function with the Go Magnesium range. It feels good to go healthy.
Well, it might only be the first week of spring, but I, for one, am already thinking about summer and a little holiday.
And dreading the long-haul flights to get us to the holiday.
Oh, I'm so with you on that, Jo. And of course, we can't make those flights any quicker or those seats less cramped. But experts have pinpointed which bit of the plane is best to sit, depending on what kind of flyer you are. Now, if you're afraid of flying, you're much better off being at the front or over the wing because there's less turbulence and there's the reassurance of being a bit closer to the cabin crew and the pilots.
Well, it's all about leg room for you and I, Nick, let's be honest with you. And do anything you can to get a bit of extra leg. You know, my pet hate is when you get caught and your knees are in the back of the seat and you look at the exit row and someone Jacqui's height sitting there with all this leg room. I'm going, that is a disgrace.
Well, I think if you're claustrophobic as well, you don't want to be crammed in the middle. You want to have a bit of space. I personally think as long as you're in business class... No, I'm kidding. I think I like the window.
Yeah, if you are someone who needs the bathroom, often the logical thing is to sit on the aisle so you're not clambering over people all the time. And if you can, sit up the front or up the back near the loos.
If I get caught out, I go the aisle, but then my legs are in the aisle and the trolley cart hits me every single time as well. So hard to win, isn't it, Nick?
Well, the only seat for me is any seat that's next to my wife.
Oh, that's so
Hey, you're making us all look bad, Nick, having said that. Well, that's all we've got time for today. Thanks for joining us on the House of Wellness. Dr. Nick Carr, Jacqui Felgate and Jo Stanley.
Check out House of Wellness Radio every Sunday with Luke Hines and Gerald Quigley.
And our latest wellness lift out with Indy Clinton on the cover.
Thanks to our friends at Chemist Warehouse and thanks for joining us on the House of Wellness.